And I'm going to show you now what preparations are in force right now as far as the Omicron variant is concerned. I apologize for what we just showed you. That was Mansukh Mandaviya, the Health Minister. But what he's basically done was basically answer some questions regarding what India's preparations are really looking like. Well, according to the Karnataka Health Minister, 2 people have been found positive for the Omicron variant of COVID-19 in Bengaluru. In Maharashtra, the count of Omicron suspects at this time has gone up to 28, including 10 from the city of Mumbai itself. According to sources in Delhi, 12 patients are currently suspected to be infected with the Omicron variant, but it's not confirmed. All of them have been admitted to the dedicated LNJP hospital in the city. In Rajasthan's Jaipur, 9 persons across 2 families have been tested so far as positive. What is worrying is that 4 of these family members have recently returned from South Africa, so it's quite likely that they may have the Omicron variant. In UP's Lucknow, 2 women have been found infected. Both the women recently returned from Kerala. They're suspected to have the Omicron variant. In Chennai, 2 international passengers, including a child who had arrived from Singapore and the United Kingdom, have tested positive for COVID. They are also suspected to have the Omicron variant. And 1 suspected case of Omicron has also been found in Hyderabad. So as you can see, 2 confirmed cases in Karnataka, but the number of suspected cases is quite large. And so the confirmed number of Omicron cases is likely to shoot up in just the next few days. Here's a list of the commonest questions that you and I are probably asking each other on our WhatsApp groups, in our neighbor groups, and hoping for some kind of clear, precise information. Does Omicron illness involve emergency oxygen requirements? The Health Minister answered one of those questions in his answer in Parliament. But let's tell you a little bit more. None of the Omicron cases so far have required oxygen support. This doesn't mean that may not change, but as of now, the good news is none of the active Omicron cases have required emergency oxygen support. Do I need to worry about stocking oxygen like I did during the second wave? Well, the government says all the oxygen shortage lessons during the bitter experience of the second wave have all been learnt, and it won't be repeated. There is more than enough preparation as far as oxygen is concerned, so you won't have to go through that. Number 3, could Omicron, the current infections grow into a second wave like disaster? Because nobody's forgotten that experience. It's possible theoretically in terms of numbers, but unlikely anywhere near that kind of scale in terms of fatalities the way it is looking right now. I want to add a caveat and a disclaimer in everything that we tell you right now, because things could change with this virus. That's the one thing it has taught us. By when will the true nature of the Omicron variant become clear? Well, studies that are on right now, both in India and abroad, will make the picture clear in the coming 2 weeks maximum. We'll have a clear picture about Omicron. Do I need to worry about medicine availability? The government says medicine shortage lessons that were learned bitterly during the second wave will not be repeated this time. Supply chains have been smoothened out in a very big way. Do you need to worry about hospital bed availability? All of us remember how there was this anxiety about whether you or I would need a hospital bed if it actually came down to that. Right now, we can tell you there's no need to worry, because worst case scenarios and preparations are being war-gamed by the government, and those are currently in force. So don't worry at this point of time. The government says don't panic, but you're already panicking a little. Everybody is. Everybody remembers what happened in the second wave when preparations were woefully inadequate. It's natural to panic, and that's why I would urge you to continue to watch India Today, because we will, I promise you, have the clearest and most up-to-date information on what you can expect, what you can do, and what you needn't actually panic about, which is